Module Overview. Pharmacology is the science of drugs and their interactions with living systems. Within the field of healthcare, pharmacological terminology is vital for communicating about prescriptions, drug classifications, dosages, administration routes, side effects, therapeutic effects, and interactions. Misinterpretation of pharmacological terms is a leading contributor to medication errors, making mastery of this vocabulary not just helpful, but essential to patient safety, clinical accuracy, and regulatory compliance. 1. Understanding pharmacological language. Pharmacological terminology helps describe the nature of a drug, e.g., analgesic, antihypertensive, its function or purpose, administration method, side effects and interactions, pharmaceutical classification. Example: the patient was prescribed acetaminophen 500 mg by mouth every 6 hours as needed for mild pain. 2. Types of drug names. Pharmaceuticals typically have chemical name, describes molecular structure, e.g., N-acetyl-para-aminophenol generic name, official name assigned by authorities, e.g., paracetamol, UK, acetaminophen, Canada, brand, trade name, chosen by the manufacturer, e.g., Tylenol, Panadol note. UK and EU often refer to British-approved names, BAN, while Canada and the US use international non-proprietary names, INN, or USP standards. Third, drug classifications and categories. First, category. Second, example, drugs. Third, description, analgesics, ibuprofen, morphine pain relievers, antibiotics, amoxicillin, azithromycin, fight infections, antihypertensives, lisinopril, amlodipine lower blood pressure diuretics, furosemide increase urine output, anticoagulants warfarin, heparin prevent blood clots, antidepressants, sertraline, fluoxetine, treat depression, sedatives, diazepam, promote calmness, sleep. 4. Routes of drug administration. Meaning. Example, use PO by mouth, oral, tablets, capsules IV intravenous rapid medication delivery, IM intramuscular vaccines, SC/SQ subcutaneous insulin, SL sublingual, under tongue, nitroglycerin PR, per rectum suppositories TOP, topical creams and ointments, ENH, inhalation asthma medications. 5. Dosage and timing abbreviations. 1. Abbreviation 2, meaning mg milligrams ml milliliters Q, 6 hours PRN, as needed stat, immediately AC before meals, HS at bedtime. Example: give 1 tab PO bid AC, 1 tablet by mouth, twice daily before meals. 6. Pharmacokinetics and pharmacodynamics, simplified. Pharmacokinetics, what the body does to the drug. Absorption, how it enters the body. Distribution, how it's carried. Metabolism, how it's broken down. Excretion, how it leaves. Pharmacodynamics, what the drug does to the body, mechanism of action, therapeutic effect, side effects, toxicity. 7. Adverse drug reactions and interactions. Common terminology includes side effect, expected but unwanted reaction, e.g., drowsiness. Adverse reaction, harmful and unexpected. Contraindication, a condition where the drug shouldn't be used. Drug-drug interaction. When one drug affects the function of another allergy, immune-based negative reaction.